Now, how do you make the diagnosis for this particular patient? Even in the case history, we saw that Grassi has this particular disease, and how would you be making the diagnosis, or what is the criteria for diagnosis in these particular patients of CFS? Now, the characteristic persistent or relapsing unexplained chronic fatigue. So this is the exact phenomena that we would be facing, or that the patient is facing. There is an unexplained chronic fatigue seen in the patient. The diagnostic criteria would consist of the patient complaining of fatigue that lasts for at least 6 months. Fatigue is of new or definitive onset. Fatigue is not the result of an organic disease or of continuing exertion. So when you would ask or put forth questions to the patient regarding the exertional activity or the physical activity that he has been facing, he would usually reveal that he is physically inactive, or even a lot of patients you would see they're obese. Even in the case history, we saw Grassi was suffering from obesity as well, but still she was suffering from the fatigue syndrome. Fatigue is not alleviated by rest. So this would be the key factor. The fatigue results in a substantial reduction in previous occupational, educational, social aspects would be considered, and personal activities would also be considered over here. 4 or more of the following symptoms are concurrently present for 6 months: impaired memory or concentration, sore throat, tender cervical or axillary lymph nodes, muscle pain, pain in several joints, new headaches, unrefreshing sleep, malaise after exertion. So this is the criteria. Not everyone is suffering from a fatigue syndrome. You have to realize that. There has to be the criteria that has to be followed. Either of these symptoms, 4 or more, have to be present for a period of 6 months, and then only you can diagnose that this patient is suffering from a fatigue syndrome. It's basically a diagnosis of exclusion. So you usually exclude the medical conditions explaining fatigue. You would exclude any kind of bipolar disorders, any major depressive disorders, any conditions such as schizophrenia, dementia, or delusional disorders. They're also excluded on part of a psychiatrist. Anorexia nervosa and bulimia nervosa. So again, it's one of the conditions that can mimic the CFS, and that's why you have to exclude all of these psychiatric illnesses once you are diagnosing a patient with the chronic fatigue syndrome. Alcohol or substance abuse, and then we have severe obesity, body mass index more than 40. So it's again one of the criteria that you have to exclude at this particular level. Now there is a particular questionnaire designed that is going to make things more easier for you as a physician and clinician. So this questionnaire explains it a lot. How have you felt during the last 2 weeks? The patient explains the symptoms and details, the fatigue, the sleep patterns, the kind of exertional activities that he has been facing, or the kind of stressful activities. The psychological stress in his environment is even going to explain a lot of factors. I felt tired is one of the criteria that he can have. Yes, that is true, and no, that is not true. So it's basically on a scale from 1 to 7 that the patient has to grade himself, and only then you can score 1, 2, and 4 accordingly. So this scaling is very important, and it's basically done by the patient himself. So it's again quite a subjective kind of a questionnaire, but still it is going to make things easier, and you can rule out a lot of factors. The stress is identified at this level basically. I'm tired easily, again, a scale of 1 to 7. I feel fit, again, a scale of 1 to 7. Physically, I feel exhausted. And then we basically sum up the score. And the sum of a score of more than 18 indicates severe fatigue that is noticed in the individual. So once you have diagnosed that this patient is suffering from fatigue, then you're going to exclude all of the other psychiatric illnesses, and only then you can identify that the patient is basically suffering from CFS and it's not a normal fatigue that he or she is experiencing. So this diagnostic criteria has to be kept in mind. Again, the key features are going to be kept in mind, and even the comorbid conditions are going to be kept in mind when you are making a diagnosis, a definitive diagnosis of CFS in the patient. It's a diagnosis of reality. You have to identify this fact. The patients are not functional in nature and they're really suffering from this particular syndromic conditions, and they need some sort of treatment or management plans accordingly that are individually designed for each patient.